Welcome to the program. I'm your host, Neil Howard. So glad that you could join us for another segment of Health Professional Radio. In this segment, we'll be speaking with Michael Axt. He's joining us here as Chief Member Empowerment Officer at Zelis. Now, Zelis is a company that's modernizing the healthcare financial experience. He's going to talk about some recent research outlining consumer frustration with the healthcare billing process, a little bit about the lack of processes for correcting errors, and a bit about the implications for payers, providers, and consumers alike. Welcome to Health Professional Radio, Michael. Thank you for joining us this morning.
Thank you for having me.
Well, give us a little bit of your professional background and briefly tell us what led you to Zealous.
Sure. Well, you're probably wondering about my title as Chief Member Empowerment Officer and what that means.
Absolutely.
Really, as we look across healthcare and across the capabilities that Zealous brings, what I focus on is really identifying and developing new solutions from across our business units to help payers, providers address the needs of their members and patients, and really the needs of the healthcare consumers more broadly across things in the healthcare financial experience that those healthcare consumers have to go through. I've been in healthcare for over 20 years. I've been in a range of roles from consulting to strategy to finance to marketing, M&A, and most recently with product development and management. And I've been at Zealous for 2.5 years, really leading this innovation around member empowerment and healthcare consumer financial journeys.
In your opinion, is it the sheer number of players in the medical financial game that make it so complicated? Are there some built-in barriers?
I think it's a mix. I think absolutely, to answer your question specifically, there are some built-in barriers. And I think it's a mix of the multifaceted stakeholders that we have to deal with across the mix of payers and the providers, the consumer themselves in that full experience and managing the financial obligations in healthcare. It's also just the sheer complexity of the care and services provided that really cause a lot of the problem as well. These are complex procedures. This is complex care, and there's frankly, as the providers can attest, there's complex policies for reimbursing that care and really helping to determine that at a professional level is one thing, but as we found in our research, as you try to cascade that to the consumer themselves, who may not be as versed in healthcare and medical billing, it only exacerbates the problem, becomes that much more complex to really truly understand.
Now, this research that you just mentioned was conducted by Zealous in conjunction with Hanover Research. Could you give us a quick overview of some of the findings?
Absolutely. Yes, as you mentioned, Zealous partnered with Hanover Research. We surveyed over 800 U.S. healthcare consumers who had found an error in their medical bill over the past several years. And I would say the findings from the research really reinforce what we all know. Healthcare billing is complicated. It's hard to understand. And what we just were discussing, just sort of given the complexities of multiple parties and the systems, frankly, the sheer complexity of the care and the billing specifically, there's a significant potential for errors. Interestingly, in this, 41% of those respondents found that they replied that they were significantly frustrated in trying to find the right person to address a billing error, and they spent a ton of time on this. It took them, in many cases, a month or more for nearly half of the respondents to get it resolved, and 70% of our respondents spent at least 2 hours of their own time working with providers, with their payers, oftentimes with their employers, to correct the bills when they did find an error in a medical bill coming across for their care. I think one of the things that we found is that, members look for both their insurance carriers and their providers for support. Obviously they look more for the providers for the care. They look more for their insurance carriers for the benefits and the coverage. But on both cases, what the research found is that they lack the clarity and confidence and really the tools to guide them through understanding their medical bills, and when they do find errors, helping to resolve it and address those bills.
Were these surprising results or more or less anticipated based on your experiences?
I hate to say that I was not surprised. As I mentioned, I've been in the healthcare industry for over 20 years, and even I struggled to digest my bills, my explanations of benefits. So I don't know that the results here in 41% of respondents saying that they were significantly frustrated in resolving bills, I don't know that surprised me so much as kind of reinforced the challenges that we all know that our patients and healthcare consumers face. I think what the results did highlight is that, these aren't just sort of modest pain points. These are real, they're widespread, and they're financially impactful as we go through this. And I guess one of the reasons why I wasn't totally surprised is, I'm not unique. I think we all have our own personal stories of challenges with navigating the healthcare financial landscape and understanding our medical bills. Several years ago, I had a pretty major billing dispute when my daughter was newborn. She was a preemie, and she needed a feeding pump when she came home from the hospital due to some GI issues related to her premature birth. And I remember I got a bill that was actually several $1,000s over what I actually ended up having to pay. And it was all due to a simple coding error where the provider had coded it as if I had bought the pump. And I guess, obviously I'm not the expert on billing, but it was covered differently if I was, quote unquote, kind of renting it from the pump supplier. And it took me weeks to figure this out. And I had to go through the prescribing physician, the discharge physician from the NICU, with the pump supplier and my insurance company and my employer, and I was kind of stuck in the middle. I had to kind of understand some pretty detailed billing issues.
Was this research important in order to just gain knowledge or to basically arm yourselves with the tools to fight these problems?
I think it's a bit of both, right? I mean, I think part of it is it's helpful to understand the scale and scope of the issues that we're dealing with as we're, as Zealous as a healthcare IT company working for resolutions and partnering with payers and providers to help to resolve these issues. So understanding the scale and scope of those, but it also gave us some significant insights. So I think, one of the things in understanding the impact here, like this is real, and I think pretty significant, right? We found 77% of respondents had errors that they found greater than $100, 25% over $500. So my example of several thousand might be extreme, but even at $500, that's a pretty significant impact when you look at that in light of research that shows that 60% of Americans don't have enough savings to cover a $500 unplanned medical expense. And about a third of the respondents who did the survey were motivated primarily because they couldn't even afford the bill as it was. So I think, in terms of understanding the scale and the importance of this, the research was helpful on that and important to really understand.
With just
as we think about it going forward, it's the reality is this impacts everybody, right? So the doctors and the providers and the medical facilities, these issues slow down their payments. It has big impacts on cash flow. It obviously reduces patient trust. On the insurance side, for the payers, it reduces member satisfaction when they don't feel like the benefits being applied. And, I don't need to talk through all the challenges that it puts the healthcare consumer in. So definitely highlights the impact across all of the players in this complex healthcare ecosystem.
What are the next steps? What do you recommend be done to improve this experience for consumers?
Yeah, I think as we look across, both the payers and the providers, it's helping to provide the patients and the members with the tools to review the bills and the claims coverage to ensure that, they're being billed accurately. They understand what's included in the bill, or on the payer side, the explanation of benefits. It's supporting them with, the guidance. One of the things that stood out in our research was that between 35 and 40% of respondents didn't understand just sort of basic elements like co-pays and deductibles and even in-network providers. And obviously this has a big implication when they don't understand those core elements of medical care and financial obligations. Understanding the details and really reviewing and navigating the bills and taking action becomes very difficult. So providing education and support to help guide them through that process. And then lastly, making sure that there's the customer service, right? They do want, one of the things we found is that they do want a bit of hand-holding, right? This can't all just be sort of outsourced to a digital tool, but how do you make sure you also got the access to the right customer service to enable consumers to find the right person, whether it's at the payer or the provider or the facility, to really navigate the process, understand the bill, know how to take action to resolve these issues, so they don't feel like they're sort of stuck in the middle of a disjointed system, and providing some of that support along the way. I think all of those are important. And frankly, it's a complex system. We may not fix the system, but I think we can provide the guardrails around it to support our patients and our members in better navigating their financial experience.
Michael, if you would, give us a website where our listeners can learn much more about Zealous.
Absolutely. The website is www.zealous.com, Zelis. And if you go on that page, you can find the full white paper to download and read under the resources tab. So more information we found there.
Michael, I appreciate you joining us here on Health Professional Radio this morning. Thank you so much for your time.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Michael Axe. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.